Okay, I think I'm going to go ahead and get started. Welcome to everyone else who's joined us. Everyone, hi, my name is Karen Turner. My pronouns are she, her, and I'm on the editorial team here at Nava. I'm so excited to welcome everyone to this event, which is Envision the Future, Lifting the Time Tax. We've gathered these accomplished panelists together to discuss what it takes to lift what our panelists, Pam and Dawn, call administrative burdens when it comes to public benefit programs. From confusing websites to being on hold for hours with a call center, these administrative burdens add up to create a time tax, especially for the most vulnerable. So before I hand things over to our wonderful moderator, Dara Lind, I wanted to share a little bit about Nava and who we are. Nava is a consultancy and a public benefit corporation working to make government services simple, effective, and accessible to all. Nava emerged from the effort to rescue and rebuild healthcare.gov after its troubled launch and exists to address some of the most complex challenges in the public sector today. So this event is going to run for about an hour, and we're going to start with a moderated portion of the panel hosted by Dara. And then we're going to reserve about 10 minutes at the end, so at about the 12:50 mark, for questions, open questions from the audience. So you can submit your questions in the Zoom chat. There should be a Q&A portion. If you're with us from Nava, you can also submit them on Slack, and I'll take a look over there. And I'm going to relay those questions to our panel during the audience Q&A portion. So before we start, I just wanted to introduce everybody on our panel. So our moderator is going to be Dara Lind, who is a journalist and a co-host and my personal favorite host of Vox's Leads podcast. And then we have Ayushi Roy, who is on the leadership team at the U.S. Technology Modernization Fund. We have Pam Hurd, who is a co-author of Administrative Burden and a professor at the McCourt School of Public Policy at Georgetown University. Then we have Don Moynihan, who's the other co-author of Administrative Burden and the McCourt Chair at the McCourt School of Public Policy at Georgetown University. And then we have Genevieve Gaudet, who is a director of design at Nava. And so with that, I'm going to go ahead and hand things over to Dara to start the moderated portion of this panel.
Thank you so much, Karen, and thanks to Nava. I apologize that I do not have a fancy virtual background. Zoom does not recognize that my face is a face, but I am really glad that everyone has joined us today. I'm really looking forward to this conversation. I think that we have, incredible brain power here, and hopefully we're going to be able to give, those of you who work in government or at the kind of government community interface, some really hopefully like tips that will help all of you going forward. Pam, why don't we start off with, I know that we kind of Karen gave us a little bit of a definition and we don't want to kind of spend too much on 101 level stuff, but how would you define administrative burden and what does it look like in practice?
Yeah, so administrative burden, right, are these onerous encounters that we have with government. And I'm going to start with an example to sort of specify the particular costs of administrative burden. So there was a 6-year-old, I'm sorry, 6-year-old Abel Sewell in Tennessee. He was a cancer survivor and he received his health insurance coverage through Medicaid. His mom and he show up at the doctor one day. He needed regular checkups. He was in remission, but still needed blood draws, treatments. Shows up at the doctor and they have no coverage. His mom finds out he'd been dropped from Medicaid and they couldn't access healthcare that day. What had happened basically is that Tennessee at the time redid its recertification process, which is essentially what you do to need to prove you're still eligible for the program. And what happened with Abel Sewell was, one, there was sort of his mom had a sort of set of learning costs, right? Like she didn't realize, she didn't get the forms, this 80-page set of forms that came out in the mail. She didn't realize that he needed to be recertified, and then she didn't get the forms, so she didn't even know what she needed to do to recertify him. There were also compliance costs. The compliance costs were things like an 80-page form. So there were actually 200,000 children who lost coverage during this period in Tennessee. And part of it was actually like this sort of 60-page renewal form. If you didn't fill it out perfectly, for example, if you even if you got the forms, the state just canceled your coverage. That's a good example of compliance costs. But then an important part of the consequences or costs associated with administrative burden are the psychological costs. And this can everything from the kind of stress, frustration, fear that can result in the context of experiencing these burdens. And so for Abel Sewell's mom and for Abel, this was like a big deal, right? This kid is a 6-year-old in remission in cancer, and she no longer has health insurance coverage for him. They ended up leveraging effectively their house. They got a second mortgage so that they could pay for his healthcare while she basically spent a lot of time trying to get him renewed on that coverage again. The consequences here are large, right? The financial and health consequences for Abel and his family, but I think also the consequences for government are large and people's views of government. How do you end up feeling about government when you kind of have these experiences with them, right? Like you're in a moment of real need. The government has promised you something to help you, and then you don't deliver. And it's not just that you don't deliver, you don't deliver in a way that makes people feel like you don't care about them. So that's the best way I can think about to articulate it.
I was, because I know we have like all of our panelists have a lot of experience working with, working with and learning about administrative burdens. Could maybe, Genevieve, could you kind of start us off and we'll go down the road by sharing your favorite example of an administrative burden?
Sure. Let's see. Hi, I'm Genevieve Gaudet, as Karen mentioned. Yeah, my favorite example of an administrative burden, I think, is sort of this classic example of a website that has opening and closing hours. I think this is something that we've seen a lot of at different levels of government. There are a lot of reasons for that we can dig into later in the panel. But imagine you really want to recertify for Medicaid. So you go to log on to that website when you've gotten your kids home and settled and they're in bed, and it's 10 p.m. the only time you have to do this, and the website's actually closed. How would you anticipate that? And then what do you need to do now in order to work around that schedule and actually get those, those forms submitted or that process done? Yeah, this is one where we see a lot of costs and not a lot of benefit, kind of all the way around.
Ayushi, why do you think that these burdens develop, and what role does technology play in this, and what role does policy play?
Yeah, thank you for that question. Hi, my name is Ayushi Roy. Yeah, they develop for a lot of different reasons, and some kind of fair ones and some really not so fair ones. I think I'll start off by saying administrative burden also has this sort of more ugly counterpart of like administrative gatekeeping. I think sometimes a lot of these choices are choices that various actors in government technology or policy might make intentionally. They're not errors. They're meant to keep out, as an example, the undeserving quote poor, as opposed to the deemed deserving poor. And so just, having shared that framing first, I'm happy to share some of the policy examples, right? There's means tested benefits and flat tested, flat benefits as an example. Flat benefits are an example is your pension payout, right? So the number of years you've worked, accordingly, you might get a certain kind of payout at the end of your years of service. Hopefully I will one day after having worked in the government for many years. A means tested benefit is an example here is your unemployment insurance, right? So you're getting a percentage of maybe your regular employment income, employed income, and so it's relative to your maybe your income, your status, single or married, the number of kids you might have, etc. And some of these policy decisions might have been made to provide more fair delivery, but the end result is actually one that adds far more cost, as Pam was saying, both psychologically, as well as time-wise, and ultimately doesn't even serve the American public, right? It erodes trust. It erodes civic trust in the government as opposed to helps build it, which I think is the most damning of these sort of administrative gatekeeping or burdens. And there's technology elements too, right? To your question, Dara, there's a lot of duplication in systems. There's not always sound usability testing in our systems, our technology. There are decisions that are being made on the basis of budgetary or political implications as opposed to technology implications. And so, one of the things that, in my former days at 18F, we'd always kind of laugh about is technology is the easy part, like pushing out code is the easy part of my job. The hard part was actually wrangling all the players to believe that it was worth not protecting the coffers, but actually distributing the service that their agency was responsible for distributing, right? That accessibility was far more important than preventing fraud. There are certain kinds of language that we found consistently came up, and that was actually the real struggle. It wasn't always the technology. So I'll pause there, but I could speak about this for ages.
Great. We will have plenty more. But Don, what's your account of how we got here and kind of who's to blame?
So I think one thing that's clear from the prior answer is that there's multiple potential reasons, and so some of these might have to do with lack of attention historically to problems. So one thing is the nature of government is that once you have a system in place, there is not quite the same incentive or pressure to actually adopt and change that system over time. And so I think one thing that we're starting to see now is a discussion about how do we design institutions in government so that you have to look at status quo processes fairly frequently and evaluate if they're working or not. That is not something we generally build into the cake of government. There are also, I think some good examples of where these burdens were deliberately constructed, right? And so the subtitle of our book is Policymaking by Other Means. And part of our goal was to point out there are lots of times when these burdens are put in place for political ends. And my favorite example is probably looking at the use of burdens in the immigration system under the Trump administration, where, for example, if you left any part of a form blank, your application would get rejected. So, you had to put in the name of your child, and you didn't put in a middle initial because the child doesn't have a middle initial, your form gets rejected. You go back in line through this very already onerous process. It's an example where the burden serves no functional purpose for government, has huge consequences on the individual, and is really entirely unnecessary. And so that, to me, that's like the paramount example of where there's just no justification behind it. There are other cases where we have these discussions about trade-offs, where it's like, well, how much fraud do we want to tolerate relative to this sort of burden? And I think here, part of what's changing is at least be explicit about those trade-offs, right? At least bring to the table empirical evidence. How many fraudulent claims do you want to remove, but what's the expense of doing that to people who are truly eligible and suddenly find themselves unable to interact with government? So I think there's multiple potential reasons there.
I'm so glad that you kind of already started steering us into this, what do folks need to be on the lookout for, and what can we do to make sure, to make sure that we're taking a critical eye toward existing processes and looking to improve them. So kind of moving forward with that, and I'm going to ask everybody about this, but Genevieve, I'll start with you. How can we tell when a particular burden is something that's already baked into the policy and can only be changed through, high up administrative or legislative means, and when it's an issue of technology or organization that can be changed from a civic technologist or policymaking perspective?
Yeah, so this can be a little bit tricky because I think Sometimes, something baked into tech will be sort of posed as, like an immovable kind of object, right? So one of the tactics we do at Nava in our projects is we use a methodology called service mapping, where we will literally list out every step that needs to be, completed to access this service, from learning about it, filling out the application, getting the forms from your doctor or your child's school and uploading them, going through that adjudication process. And then we'll begin to list the layers involved. So, an applicant needs to do this, it will go into this system, that data will go over here from this API, which is governed by this regulation, which is governed by this policy, and so on. And so we can really begin to drill down into those layers. And in the case of that example, where, maybe a website is closed overnight, a lot of sites that were built, maybe 30, 40 years ago, in the public sector, which have this kind of pattern where they close for hours, at night. What they're usually doing is there's usually like a big mainframe in the background that's like moving data around, and that's quite a sensitive process. So they will do that with the website closed so that nothing comes in and kind of disrupts that process. And that can be posed then as like, well, it's not a technology problem, it's a money problem, right? It'd be very expensive to change that, so we don't want to. When in fact, if you begin to drill down, technically it's quite feasible. There's modernization funding all over the place that I hope Ayushi will tell us more about over the course of this panel. But it may actually be a problem of political will, or it may be gatekeeping posed as a technology problem. But if you begin to list those layers, you can begin to have discussions about like what is really going on here, and where is actually the leverage point that you need to hit for this particular problem.
Pam, do you have kind of thoughts about that kind of leverage point and some other ways that that's broken down in your work, or rather in your experience?
So leverage to reduce burdens, basically. Mm-hmm. Well, so I do think, one of the tensions and problems at the state level, Ayushi sort of referenced the point about fraud and how a fixation on fraud can lead to just much higher levels of burden, which is completely true. But one of the challenges that the states face when they're administering federal programs, whether it's unemployment insurance, whether it's Medicaid, SNAP, they're in a position where if they have a lot of folks who end up on those programs who aren't supposed to be receiving benefits, who aren't actually eligible, or who receive a higher benefit than they're supposed to. The feds can really tax the states when that happens. They have a range of different ways to basically incentivize the states to prevent that from happening. So oftentimes what the states are doing when they enact burdens is actually responding to incentives set by the federal government. This was a real issue around unemployment insurance, actually post-Great Recession, and some of the expectations that the federal government set. And to be clear, when I talk about people like getting benefits who aren't supposed to, usually it's actually not like fraud how you would think about it, like fraud, like people trying to cheat the program. It's just like super confusing. The earned income tax credit is a great example of this. Like, it's just really confusing. And so people end up receiving benefits that they're not eligible for, or amounts of benefits that they're not eligible for, just because it's confusing. But basically, the feds can set a different set of standards that make it more possible for state governments to reduce burdens. And in fact, recent guidance around the Paperwork Reduction Act that the federal government just issued, I would argue actually gives states a bit more flexibility, because basically what the federal government is saying, if you administer SNAP And you have to account for all of these costs. You have to account for costs about requiring people to come in person for an interview. You actually have to document that, account for that, and think about that in kind of a relative cost benefit way. So I actually think a lot of what's going on at the federal government in terms of executive orders, the Paperwork Reduction Act, guidance around that may give states the flexibility to reduce burdens and set a different set of incentives, excuse me.
Totally agreed. And I think that is that, this idea that we need more, sort of filters to make sure no one who shouldn't be on this program gets it can be, if we look at that layer cake, it's like it can be sort of spun as like a regulatory requirement, like, oh, you must report, your work activities or your job search activities to Medicaid if you're not already working, or things like this. When in fact, it's like a political, that was sort of by the last administration, a really big push to say, like, we're really making sure that people who don't deserve Medicaid are not on it. And it kind of is then spun in this like deserving poor, and just sort of more gatekeeping around programs that costs a lot to then implement, to build the systems to track all of that. And I would argue is not worth it, but it's, up for debate, I think.
So, as someone who's a student of public administration, my PhD is about studying bureaucrats. Part of the issue here is how much discretion people to believe that they have to engage in change. And so I think partly it's like, what is the license for change that you think that you have? There's also statute about what you can and you can't do. There are these sort of power players within bureaucracies like general counsels, who often have the final word about, oh, we can do this or we can't do this according to my interpretation of the statute, or we can share this data or we can't. And I think those are all powerful factors here. One potential downside is that as we institutionalize these processes, there might be a tendency towards nudgism, which is that you focus only on the sort of doable, feasible change rather than dealing with the underlying structural issues that might matter. And there's lots of sludge to deal with, so that's not necessarily a bad thing to think about, what are tweaks that we can make. But I think it also maybe requires cultural change in government, especially in places like general counsel offices, to get the lawyers on board with what the people who are actually trying to implement change are trying to do.
I actually wanted to double back to you, Don, to kind of zoom us out even a little bit more. If we look at administrative burden as like a full regime, right, and look at kind of the aggregate costs that it poses, especially on marginalized people, like, what does that do for things like trust in government, participatory democracy? Like, what are the kind of larger moral costs, you might say, of a burdensome administrative state?
Yeah, I think part of the reason why we wrote the book is that we were interested in issues of power and equity and the role that the administrative state plays in those dynamics there. And there's this sort of standard economic model that's been around since the 1980s that sort of argues that putting a few ordeals in front of people is actually a good way of rationing services, because only the people who truly want those services will wait in line long enough, will deal with the hassles. And so in some sense, a little extra burdens is a good thing. And we took a very different perspective, partly based on the idea that people who are most in need will probably have maybe the least time or resources to overcome those hurdles, right? And so it's quite a different perspective that I think hadn't been necessarily on the mind of policymakers. There's also the issue of street level bureaucrats who might engage in discrimination, which is one thing that we know street level bureaucrats do. So as an example, in a non-US setting, we looked at the applications of Muslim families trying to get into schools in Denmark, and we saw that they had these higher bars that they had to overcome, including just the email interactions with these Danish bureaucrats in order to transfer their kids into another school. And that sort of micro level use of discretion by bureaucrats, if you experience a lot of it, your experience of the state becomes an experience of burdens, right? It becomes, the face of the state becomes one that asks you to fill out another form, to go that extra mile in order to get public services. And I think it has to be apparent to people who are experiencing this that this is a different way of being treated than perhaps they desire. And so if there's enough of that, you think the long run effects is probably going to become negative on people's outlooks towards government. And this is certainly sort of an area of research that people like Jamila Mishner of Cornell University has written about the context of Medicaid. If your experience of the state is constantly one of hassles and burdens, it's very hard to imagine you have this sort of warm and fuzzy belief about it afterwards.
One thing I want to chime in on about this is like to just emphasize the level of invasiveness sometimes in terms of these burdens, like just extraordinarily invasive. And I'll give you two examples. So one is around the state regulation of abortion, right? So there are experiences that where women are actually forced to have a vaginal ultrasound in order to enact a basic right that they have, which is the right to an abortion. It's an extraordinary level of invasiveness that burdens can kind of manifest themselves. The other example I would give, I'm working on a paper right now around ID requirements, right? Like you can't do anything without an ID, right? You can't vote in a lot of places, but like you can't work, you can't travel. And in 8 states, trans individuals are required to prove that they had surgery to change their gender identity on state ID. So right, like the level, like these sort of tools of the state that can be not just sort of difficult or like, some frictions, like just extraordinarily invasive. And so that's like a not great presentation of the state, right? I think from a moral perspective personally, but then also just how people come to understand the state.
One thing we mentioned at the start of our book is, our simple normative stance is that people's experiences with government should be simple, accessible, and respectful, right? And anytime you deviate from those 3 qualities, you should have a very good reason for doing so. Like there should be a very strong normative counterfactual for why you want to not treat people respectfully, why do you want to make services harder to access, and why you want to end up making people feel less good about their interactions with government.
Sorry, I want to spend as much of our remaining time as possible kind of talking about potential solutions, fixes, kind of making sure that we explore kind of, the possibility space of what it looks like to have a less burdensome state. So Ayushi, can you start us off? Like, what does it actually look like to reduce administrative burden?
Yes, thank you. First, I want to point us back towards the service design work that Genevieve was mentioning. I think it's really, really critical that teams in this space take the time to chalk out each part of the journey for a user engaging with whatever public benefit it might be or service, and really asking, well, why is this here? Are we cutting the meatloaf at the ends because we've always assumed to have a smaller pan, or is the pan actually bigger now? We can let it be. Is there a good reason for this? And sometimes it really ends up being kind of a personality and player, as opposed to maybe a policy. And that's worth interrogating first. Second, there are sometimes just beyond the purview of the work of technology teams, similar technologies doing duplicative things. I'll give an example. When I was at 18F working with the Centers for Medicaid and Medicare on revamping the children's health insurance program surveys that states had to submit to CMS to get their, next year's grant. One of the things that we were asked to focus on the annual and quarterly reports that states submit to CMS. Okay, great, we'll do the thing. We're chugging along, doing the thing. And then we began, doing our due diligence, interviewing the various people involved on the CHIP program across CMS, and began to realize, wait a second, why were there more versions of the same quarterly annual report that the finance team was using and different versions that the business team was using? And it turned out the technology, the business, and the finance teams all had different versions that they were all asking states to submit. There wasn't just one quarterly report. There were like 3 to 5 quarterly reports. And each quarterly report would take roughly 40 to 80 hours of a state administrator's time. For states that are more resourced, like New York or California, okay, that's an annoyance. But for smaller states with less resources, I can remember there was a woman named Fern in Alabama. It was a one-person office. She was CHIP for Alabama. And bless her heart, I will always remember my conversations with Fern. And she would spend weeks, months just working on the quarterly report. And that would then take away time for her being able to actually administer the benefits that she was hoping to administer, right? And so this is all to say that look a little bit beyond. If you're a technology team, look a little bit beyond the scope of your work and ask around, look for duplication, look for ways that we can actually sunset some of these duplicative systems. And I hope this goes without saying, but bake in really, really solid public user testing as much as you can along the way. There are so many things that might seem obvious or basic to us because we are always immersed in the work, but are not really obvious to the applicant. There's sometimes simple questions like, what county do you live in? Is that really necessary? Can we figure that out in other ways? Believe it or not, a lot of people that I once was working with in unemployment insurance could not tell you what county they were in at that given moment. And it wasn't necessary for us to know in the first place. So let's just nix the question. I am personally a very big fan of removing questions and reducing the length of forms and questions involved. Sometimes these burdens just don't need to be there in the first place. I'm also a fan of not asking the same question twice. We don't need to do that. Maybe we can get the information that the constituent has provided from another related office. And so those are some of the ways, among others, that I would encourage those on attending this lovely webinar to keep in mind as they continue their work.
Can I jump in here? With some of the work we end up doing on the ground. I think at Nava, we've seen that when we have the opportunity to come in as a technology team, as a design team, as a product team, also bringing in, policy analysts who are from Nava, but really partnering with, policy specialists within the public agencies that we are partnering with as a vendor, partnering with the program, business folks in government has been so critical. And we had this really singular experience at Nava over the last few years where we've gotten to work with the Commonwealth of Massachusetts as they've built and launched their paid family and medical leave program. And one of the things that they did as they were writing their regulation and soliciting that public feedback on the regulations is we also had a chance to really sit with them and talk about this is what it will look like to implement some of these regulations, and we're able to have some really nice collaboration with them to try to avoid baking in as best as we could some of those burdens. And I think one really beautiful example of where the Department of Family Medical Leave in Massachusetts really prioritized putting those applicants, they call them claimants in the context of paid leave, First was our research found that new parents, so someone who's having a child, didn't really think about maybe the medical related leave when you are pregnant prior to having a child, and the bonding leave afterward as separate things, though in the regulation, technically from a program perspective, they are different. For that program, there's like different, balances you might have. And so they really, stepped up to the plate. If you were going through that experience in Massachusetts, you can do one application, it's ahead of time. And then you can kind of really smoothly transition from one leave to another, rather than kind of asking new parents to fill out 2 applications, et cetera. And we've really seen that team invest a lot in user testing and having groups from, kind of the different parties involved, healthcare providers, employers, claimants, et cetera. And so that multidisciplinary approach really coming in early and being willing to look at regulation in addition to just looking at roadmaps and prototypes, et cetera, has really been successful for them, and I think is a great model.
Genevieve, I'm gonna piggyback off that again. I'm so sorry, y'all. I'm just so excited about this question. Okay.
No, this is why we have you on the panel, so you can talk to us, you can brag on yourself.
Oh, it's not about myself at all. This is like stuff I've observed that just gets me so inspired to keep doing what I do on the day-to-day basis, right? One other thing that what you were saying, Genevieve, reminded me of that I wanted to flag really quick here was thinking not just about the burden on, I think when we use terms like administrative burden, or as we were saying earlier, administrative gatekeeping, we're thinking often about the public, right? The American public, the user of the end user of a benefits or service program. But I actually want to also flag that it's really important to think about the internal user, the administrative user. And the reason I say this is because, believe it or not, it's one through line. Like, if you make it easier for the administrator of that service, chances are you're going to actually be making it easier for the end user of that service as well, right? And one more question you're asking the end user is one more data entry that the administrator will then need to process and manage error for. And that one error, as Pam was sharing earlier, could be the difference between the child's and their parent getting support or not getting support on that day. So just quick plug for looking out for the internal users.
Yeah, I think the something we've talked about is the balance between individuals and the state in terms of how much burdens are shifted between the 2 actors. And you're looking for solutions that are basically win-wins that reduce burdens on both actors, sets of actors if you can. Because if you impose more burdens on an already overburdened set of public employees, that's probably not going to result in positive outcomes. To the sort of broader question of how do we institutionalize this in government, I think it's helpful to think about it in terms of 3 different levels. One is you have to institutionalize some broader set of changes where there's something like the executive order that the Biden administration has written on customer service, where it empowers the center of government to say, thou shalt do the following, and sets up these sort of regular reporting processes to say, here's how we've minimized burdens. Like, I think you need that high level license for change along with leadership support. Number 2, you need capacity, right? And that is partly internal capacity. Sometimes it's folks like Nava who can come in and actually do the work. It's also education about the nature of the problem. It's also the fact that people are familiar with the terminology, that they know what administrative burden is, they know what human-centered design is. So I think there's some catch-up that needs to happen in the public sector for that to occur. And then I think there's the more micro or more specific toolbox of solutions. Like, what is it that we did in Massachusetts that worked here that will probably work in Oregon if they try to implement the same sort of family leave program? Like that sort of level of sharing of technical fixes. But I think you need all of those 3 things happening. You can get far using 1 or 2 of those approaches, but you need them all to be going in the same direction if you really want to change government.
just had sort of a smaller point to build up of Ayushi that falls maybe more into sort of the sort of micro stuff Don is talking about in terms of solutions. But I do think one thing that happens when you were talking about the parental leave in Massachusetts and like sort of people's understanding, just like the program. And I do think one thing that happens sometimes is that people who design the forms, who communicate about the program, use kind of a language that works internally, that within those organizations, but that people outside those organizations don't understand. So we had a paper with some folks at Code for America, where they designed an intervention basically that, like, it's so simple on some level, like, what do you mean by self-employed? But it has like these huge consequences in terms of whether you're eligible for and the level of your SNAP benefits. And just doing a better job conveying what you actually mean by self-employed. Actually, you know, like it had an impact. So yeah, sort of at that micro level, that's like a sort of super specific example of how that stuff can play out in kind of problematic ways.
Yeah, I love that example. When I worked for the city of New York in a previous life, some of the work we did was to create, it's a very jargony thing to say, a content API that took all of this information about public benefits and translated it in that way, so that people could see themselves in the program. You know, the difference between a page that has like supplemental nutrition assistance program across the top versus help buying food. You know, like the ability to see like, oh yes, okay, this is what I need, or this is what I am looking for. There is such these moments are small, but they compound, you know, and they really help people kind of move forward or figure out like where they want to invest their efforts.
These are problems that are more, so, you know, in terms of like means tested programs like SNAP versus more universal programs like Social Security, this is more of a problem, right, in those means tested targeted programs. In part because like most people really do know what Social Security is, right? Like, and they know that when they're, you know, when they reach a certain, I mean, there's some details that maybe are a little bit fuzzy, especially for younger people, but as you approach the age, it's not just uncomplicated because the program is sort of designed in somewhat simpler ways, less simple than people realize, I think, but also because there's just a brand name thing, like everyone knows, like whatever, SNAP, like what? So this is more of a problem for these sort of means tested programs, basically.
Genevieve, I want to pivot back to you. How can we actually tell and measure when a burden is being reduced?
I mean, this is, so there are small ways, right? And I think this goes back to something Don was saying about like, how do you as a public servant, as a technologist, kind of see your lane, the width of your lane in terms of like the kinds of change you can make, right? It is relatively easy to measure small ways. So how long does it take to fill out this form? It's a quantitative metric. How quickly can we process an application? What is the qualitative feedback we receive when we test this or when we observe people using it? Do they say, this is easier, this is clearer, I feel more confident, or I understand this process? Or even sometimes we will do testing that's like, we'll show you a web page or a paragraph and say, what do you think this program does? You know, we did that in Massachusetts with the paid leave program, and we got a lot of information about how people talked about the program, how they thought about it, et cetera. Those are things we can measure, and those are things we're measuring kind of all the time, you know, in product development. We have these metrics. But, you know, I think I said earlier, these burdens can really compound. And I think Pam made a really incredible point about how invasive certain programs can be. And I think it is impossible to kind of talk about this and not say that, you know, for some people, the government is a presence that came into their house and sat on their couch and asked them questions. about their family, you know, and was this very kind of overbearing sort of thing. And we inherit all of that, even when what we are working on is like a website to tell you about COVID-19 restrictions or helping you get, you know, paid leave to bond with your child. And these are all the same thing. I once did a user test in Maryland where we were trying to like make an application like really shiny and zippy and pretty. And the woman looked at me and she said, "This looks great, but it's still the government." You know, and I will never forget that she said that, because I think while we can measure smaller things, we can measure health outcomes over time. We can, you know, the social scientists here would love to hear how you, you know, think about some of those bigger outcomes. It is really difficult to measure the sort of psychological toll and emotional burden over a lifetime, over generations. How does that affect, you know, your community, your children? What are we inheriting? Like, ooh, it's a really generational, you know, and I think community effort to impact these things. And some of those measurements get very, very tricky when we really zoom out.
One thing, so a plug for Pam and I doing new research where we're trying to come up with a standard measure of administrative burden that different programs and agencies could use that would get at some of these issues, but you could also use it for research purposes. So if there are state governments who are interested in partnering to pilot some of these, I would love to talk to them. Email me.
We have a bunch of questions coming in, so I wanted to kind of open to kind of pass those along to y'all. First, we have one that Karen has passed along from Slack. It seems like for every one burden resolved, 2 new ones emerge in its place. How can we get ahead of new administrative burdens being created? How can we avoid new burdens coming up?
I'll give this a try. So I actually think like a maybe relatively incremental answer to this question is the new guidance around the Paperwork Reduction Act. Because effectively what that new guidance does is it now really, like, so the way that it used to be sort of used was like slightly haphazard. And so basically like an agency, like for example, around Social Security disability, they were looking at doing some rule changes around that during the Trump administration. And so the agency, in accordance with the Paperwork Reduction Act, tried to account for like how much time it would take if they made this change. But the only way that they accounted for it was literally by like looking at the form that people were going to use, and then just said, I talked to like 8 people and then said, oh, it'll take them like an hour to fill out the form. What they didn't account for though, was the amount of time it would take people to gather together all of their records, their health records, all of the additional documentation that they'd need, all of the time it would take to actually gather information that maybe they didn't need to send to SSA, but that they would need to actually fill out that form. And now, amazingly, it even requires entities to take into account the psychological costs. So what does it mean to ask someone who is disabled and unable to work to kind of go through this process of like gathering all this stuff, proving yet again that you're still disabled. So it really is a meaningful way, I think, if it's properly implemented, if agencies, states, entities actually want to leverage this to kind of prevent, at a minimum, new burdens from being created. This is not a cure-all, but it is absolutely a potentially incremental and important way to do that.
I totally agree. And I think I would add that there is an exciting, trend that I think is heavily influenced by academia that we're seeing more and more agencies take on, which is these small, pilot programs, very small, where we can actually try out some of these interventions and say, okay, if we introduce this tool to upload documents, does that allow people to do it at 2 o'clock in the morning when they finally have time? Does that save people from driving to an office to drop off, documents? And as we user test that and prepare it for like a pilot, we could say, okay, let's have 50 people do it. And then let's really learn from them. Let's make sure they're representative of sort of those use cases, a person with disabilities, maybe a person whose preferred language is not English, et cetera, and have the government staff fully process that. And we can see how it works, and we can try to anticipate some of those burdens or learn more about them. And I think that where I'm hoping this shift goes to doing pilots is we see, more and more sort of design and technology pilots, and I'm hoping to see more appetite for those pilots failing, right? If we make them more ambitious and we allow them to fail and say like, oh, actually, we found this increases a lot more burden, for internal users, which makes the whole thing slower, and that wasn't the goal. So let's try again. I'm hoping that as we get more comfortable across government agencies with some of these like agile product development principles, where you're trying things and then you're working on them again, and then you're putting it out into the world, that permission to fail and not have that be considered, a waste of public funding or really embarrassing to go in front of the governor or, your state legislature or, whatever your oversight body is. I think that is really when, again, not a cure-all, but we'll be in a much better position.
Questions from Ellen Butters about fraud. Namely, are there tactics for reducing the fear of fraud? Aren't there some legitimate concerns about fraud? And are there fraud-reducing tech products that don't add burden?
So I don't know if there are tools to, easily detect fraud. There are some cases where, for example, using data sharing of administrative data probably both reduces risks of fraud as well as reduces burdens on individuals, right? So I like that, to me, is an example of one of those types of win-win policies. I do think absolutely concerns about fraud are a legitimate public value, but this goes back to the weighing of trade-offs. So if I introduce a policy that reduces 10 cases of fraud, but it also eliminates 10 eligible applications, am I okay with that trade-off? That's a political judgment. If I reduce 10 cases of fraud and 1,000 eligible applications, am I okay with that trade-off? At least politicians should be transparent about those two values, which means that we just have to have more empirical evidence about the nature of those trade-offs in a particular policy area.
I just want to, oh, sorry, go ahead.
All right. Yeah, I'm just going to add in there, there's, I think, another way that I've found the sort of existential fear of fraud, particularly at the state level, the state, of state administration of federal benefits, has been around just really diving into what kind of fraud we're talking about here. I think sometimes fraud is this like nebulous thing that everyone's just really scared of. Not everyone, particular players are really scared of. And it's helpful to really dive into the data from the current fraud that has been found, at the very least, start there and figure out, let's start with, I'm thinking about unemployment insurance here, is it benefits fraud or identity fraud, right? A simple example, is it a case of me as someone who already qualifies getting more in my unemployment check than I should be getting, which is benefits fraud, or is it that I shouldn't be getting a check in the first place, that I'm faking my identity to get the check, right? Which is identity fraud. And those have very different those mean different things. They have different penalties from their federal counterparts. And they also have different methods to tackle them, both from policy and technology standpoints, right? So one is just identifying the problem more clearly. I think the second way of kind of combating you to answer Ellen, right? I think that right. Ellen's question here is also thinking about the interests of the political players involved, right? One of the things that I think, Dawn, you're mentioning, you're alluding to here as well, that I found in a previous case with unemployment insurance was that there was this fear of the state draining its coffers. That was what they feared, losing money and not being able to get it back in turn from their federal grantor. Whether it's a legitimate fear or not is actually not my job, but what I could do with the technology, the team that I had and the opportunity that I had was begin to think about building out solutions in ways that would assuage their fear. So, a simple example was we decided to actually start by building out an overpayments collection system first, which you could be like, I'm sure there are many listeners out here that are like, oh God, what were you doing? What are y'all thinking? And I hear you. It was not my first choice either, but we used the tool that we built as a way of buying trust within the team and the players that we were working with, right? The State Department of Labor. And sometimes for political players to just see a mock-up of something is actually heart-changing, to be like, oh, you could build me a smoother overpayments collection system, which then assuages their fear of draining the coffers. And then they'll give us the cover to actually go out and build a more streamlined, less burdensome unemployment insurance verification system second. And sometimes just using the technology as a tool, right? Using your product skills or design skills, engineering as a tool to build internal trust before you can build public trust is an opportunity that we have with our product skills or other skills for those that are on the government technology side listening here. So those are just some ideas of ways that I found really effective. And actually the third I'll give, which is a success story, I think, of administrative burden reduction, and I'll keep it really short here, is Rhode Island. The former team at Rhode Island decided to build a career matching form before they built their unemployment insurance forms, as a way of encouraging and connecting people to sustainable jobs, and then using that information to auto-populate their checks and their income verification. Brilliant, instead of requiring every 2-week verification for income. Pause there.
I appreciate that our panelists are already kind of jumping in and answering typing in answers to some of the other questions. Since we are nearing the end of the hour, I was hoping that if folks have kind of final thoughts, if there are things that they wanted to take this opportunity to say, or more success stories they wanted to tell, the floor is open to folks.
I think this is like a super exciting time. Right, I think this is a great time where you're seeing people from the civic tech community, people from academia, people who are stakeholders in specific policy areas like the social safety net, finding each other with the shared goal of making government work. So there's a lot of dysfunction, but I also see a community that didn't exist 5 or 10 years ago. And I see a lot of potential progress there. I see people from the philanthropic world coming in and seeing this as an opportunity to help. So the US administrative state is sort of cobbled together, doesn't always work, doesn't always function, but this is actually sort of a good moment if you're interested in this area to be part of this conversation and this movement for change.
If I don't mean to keep anyone any longer than we already promised you. So thanks everyone for participating. Thank you so much to our panelists. Karen, I will kick this back over to you.
Yeah, just wanted to say thank you so much. This was a great event. I loved this conversation. I know anyone who's on Twitter, there's like a tweet thread there if people want to chime in there as well. And really appreciate everyone's time, and thanks so much.
Thank you for hosting this. This was so much fun.
Yeah, this was great. Thanks, Karen.
Thank you.
Bye, everyone.
Thanks, folks.